Hello. Thank you for joining us with the Center for Justice and Law Spotlight Conversation, where we talk about topics related to health, justice, and law with guests. I'm Lillie.
And I'm River.
And we're students in the Health, Justice, and Advocacy class this semester. We're partnering with the CJL. Today, our Spotlight Conversation will focus around the topic of birth justice in prisons. And our conversation today will be with Dr. Rebecca Shlafer. Thank you for joining us.
For having me.
Of course.
So I've asked you to join us because we saw your interest in work with children whose parents are in prison, as well as the programs and policies that impact families with incarceration. You inspire us because of your work within this community and with things like supporting the Healthy Start Act. Could you tell us a little bit more about yourself and what brought you into this work and some of the work that you feel most connected to?
Yeah, sure. Great question. So my background is in child psychology, and I think that my pathway into this work now feels a bit more linear. You know, at the time, I think as you're sort of going through your undergraduate degree and graduate degree, at least I felt like a little bit lost. And now as I look back, it feels much more linear in terms of the things that sort of had my passions connect to one another over the years. So I came to this work really as an undergrad at UW-Madison when I was interested in children and families who were being raised by their grandparents. So I had done some research experience with grandparents raising grandchildren and found myself really drawn to their resilience, really drawn to the experiences of grandparents who looked very different than my own and who were thriving despite tremendous adversity. And I think those early experiences, hearing directly from people impacted by complex experiences in their communities, helped me really root myself in issues where I felt like, okay, we can apply research and science in this space and really listen to the voices of people, center their lived experience. And that, I think, is sort of the earliest work. I had wonderful opportunities along the way then to work with children who were participating in Big Brothers Big Sisters for a mentoring program for children affected by incarceration. And then really the work that has maximized the last 10 years of my life has been with the Minnesota Prison Doula Project. And in many respects, that work came to me pretty serendipitously. I knew that I was going to be staying in Minnesota at that point in time. I was geographically bound. I think many people come to Minnesota thinking that they're going to get in and get out. I was one of those. I didn't think I would be here for the rest of my adult life, but I came, and once I knew I was going to be staying here, I reached out to the Department of Corrections, and it was a very just cold call email, if you will. And I said, I was a postdoc research fellow at the time, and I said, sort of, what's happening with parenting in your women's prison? Is there anything happening around parenting education, parenting support? And are there opportunities to get involved, to just learn more about what you're doing? And I say it was serendipitous because they had just given permission for what was then ISIS Rising at the time, right, 12 years ago, to start offering group-based parenting classes and doula support, one-on-one doula support for pregnant people in the facility there. And I had a conversation with Erica Garrett more than 12 years ago now, and it was just the right call at the right time. And how can I help, really? What are you working on? How can I be involved? And more than a decade later, we're still in partnership with one another. And I serve as the research director for the Minnesota Prison Doula Project. And that has been, that phone call, those emails were really life-changing in terms of my trajectory and the work that I do now.
That's amazing.
Yeah, that's awesome to hear. It's always fantastic when you can find a line of work that aligns with your own views.
I always feel like it kind of just falls into your lap. Kind of, you know, you think you're going to go one way and then it doesn't.
It was meant to be.
Yeah, I believe that. Yeah.
So our next question here, starting off with a little bit of a fact, about 1 in 28 children have a parent who have been incarcerated. What are some of your biggest concerns about children's mental health and development when they have a parent who is incarcerated?
Gosh, that's a great question. Yeah, I think that we know that for many kids who are experiencing the incarceration of a parent, they have often a whole constellation of risk factors in their lives that can compromise their mental health, right? So maybe it's not just the parent's incarceration, but it's all the things that could precede the parent's incarceration, right? We know that folks who are going to prison and jail in this country often have undiagnosed or untreated mental health issues. And so for kids who are living with parents before an incarceration, they may have been exposed exposed to right, a number of challenges, whether that's that parent's substance use issues or their mental health problems, things that ultimately resulted in the parent becoming incarcerated, maybe compromise the parent-child relationship, right? So it's really hard to be a whole and healthy and responsive parent if you have an active substance abuse disorder that hasn't been treated or you're struggling with. And so I think that's part of it when we think about children's mental health, is sort of all the stuff that came before incarceration. And then we know that when people go to prison and jail, those are not environments that are supportive of families. They're not environments that are supportive of parents. Most prisons and jails across the country don't have parenting programming. And if they do, it's really not evidence-based. And we don't know really how parents are supported in that way. And these are environments that are not built for children or families, right? And so we can think of the additional trauma that can happen when kids and have an opportunity to like be their parent, and how challenging that is in an environment where, you know, they can't hug or touch their parent. They can't, you know, sit down on the floor and play a game together. They can't sit on their parent's lap. Moms can't breastfeed their babies during that period of time, right? So it's all of these things then about the environment. And I always tell people that even when a parent comes home from prison or jail, and it's a very welcomed thing, that's a tremendous challenge for families to navigate. And reentering people have tremendous barriers in terms of housing and employment. And then you layer on, how do we reconnect as a family? How do we reconnect and renegotiate roles and responsibilities, particularly if someone else was caring for their children at that time? And so again, in terms of children's mental health, I think what this all means is that these are kids who are experiencing a lot of change and a lot of transition and a lot of unpredictability and uncertainty. And so that can be really challenging in thinking about how do we best support these kids throughout their development and at different stages, depending on how long the parent is incarcerated and where they're incarcerated. All of that begins to really play into what do we need to support kids and their mental health.
Awesome. Well, thank you so much. That was very insightful. Moving on. So when the Healthy Start Act was passed in May of 2021, what changes have you personally seen in these children's relationships with their mother or parents and their mental health and development? Has it been overall positive or negative, or what are some of your thoughts on that?
Oh, good question. And I feel like we should get to this conversation a year from now when I feel like we know more. I think it's too soon to tell, right? So the Healthy Start Act was passed last year, as you said, but we didn't really start seeing cases or people accepted into sort of the program until really January of this year, 2022. And so I think it is too soon to say. I think we know in my conversations with the doulas who are helping do some of that work and administrators with the Department of Corrections, these are really complicated families, right? Not surprising. Who have different needs. And I think one of the things that we're probably learning is just how individualized caseworkers will, like sort of the casework piece of this project will need to be for really supporting moms as they're released from prison and supporting them, right? And all of that is like, what do they have in terms of housing? What do they need for substance use treatment? What do they need for mental health counseling? What do they need for just a social support network that is pro-social and good for them? And I think an individualized sort of tailored approach to that is something that will have to be worked out. And I think we just don't quite know yet beyond ensuring that moms and babies aren't separated from one another, which will have huge implications for infant mental health and child well-being. I think like, let's stay tuned and see what happens a year from now.
Yeah, I can totally see how that connects to your background with child psychology, and I bet it's gonna be interesting for you to like watch what happens in this next year. So kind of connecting to that, since we don't really know like what's gonna happen yet, like what was it like getting the bill passed, and what were some of the struggles and difficulties you had to face?
Gosh, isn't it all a blur? It's like, what you know, the last 2 years, when did we do that? What did the legislative session look like? I'm trying to like go back in my brain because it feels like we're in the midst of another session right now. And so it's sort of like, where were we at? What was that like? I mean, I'll say that this has been a long time coming, right? In the sense that this was not work that happened overnight. This was, we have, Erica Garrity, Ray Baker, and I have talked at length before, right, about just the early seeds that we planted as a program with the Department of Corrections and with leaders in this about the population that was being served through the Minnesota Prison Doula Project. And I, have emails going back from like 2012 where conversations with leadership in the Department of Corrections documenting for the first time ever the time between when a person gave birth and when she was released from prison. And for the first time ever, we had data about like, whoa, this is actually a really short period of time. And it begs the question, right? If most women are getting out within 6 to 9 months of giving birth, why are we keeping them in prison? What are we doing, right? And those were conversations that we were having a decade ago. And so in some ways, the Healthy Start Act passing was really exciting and felt like it happened really quickly, because it did. By the time it was introduced, it was one legislative session, really great bipartisan support. But we were, I think, planting these seeds for a long time to really get people to think about, are pregnant and postpartum people's needs being met in this prison? Are moms and babies' needs being met in this way? And I think the clear answer was no, but I think it just took us some time to really develop an evidence base to be able to advocate for getting these moms and their babies out of prison, right? And really giving them an alternative to what we were currently doing.
It's awesome to hear all of the work that you're doing with this. Obviously, this issue isn't necessarily highlighted, and it's not something that most people are aware of. So it's really inspiring to hear about all of the work that you do with it.
Thanks.
We have also noticed that you've worked with Autumn Mason in the past. She just presented to our class on Tuesday, and she is wonderful. We love to hear her story, and an overarching theme throughout this semester for our class has been the power of stories. How did her story specifically inspire you?
Gosh, so I don't know if Autumn talked about this at all, but so I adore her. I adore her and her mom. As Autumn shared, she was a participant in our program, but I didn't meet Autumn until we were working on the first round of legislation when we were trying to pass anti-shackling legislation. And at that point in time, I was chairing a legislative advisory committee, and we really wanted to get the perspectives of folks inside and bring that back to the legislative advisory committee. Now, in a perfect world, right, those folks inside who are directly impacted by this issue would have been able to go to the legislature. They would have been able to testify. But this was sort of the best next thing, which was to go and talk with the pregnant and postpartum people at Shakopee and bring that back to the legislature. And so that's what we did. And it was during that time that I had an opportunity to meet Autumn. What I didn't know at the time that I met Autumn was that I had an ongoing relationship with her mom, because her mom had reached out to me separately. And I didn't put these pieces together for some time, that this was Autumn's mom that I was communicating with. But she had reached out looking for some support for caregivers who were impacted by incarceration. And she was joining some community conversations that I was helping facilitate. And I got to know Jolene in that conversation. And truly over the last many, many years, so probably 6 to 8 years, knowing their family and their perspectives, like they have radically shifted my thinking about the ways that we can support families, and having Autumn now out and thriving and being connected and a leader in the Minnesota Prison Doula Project has just been so powerful for me to watch. And it just, I think, just reaffirms like the power of second chances and the power of opportunity and what we're doing, what the collateral consequences are of incarceration for children and families, and not just their children, right? But in talking to Jolene, the consequences for her as a caregiver and just the ripple effects that it has for families. So now I feel like I didn't answer your question, but I will say being connected to both of them has just been really, truly life-changing. Not an underestimate to say that.
Yeah, she's a sweetheart. And honestly, like her story really moved our class in general. And she's a phenomenal speaker now. And I for sure think that seeing her out and thriving and really showing what rehabilitation looks like and how it can positively like affect the Prison Doula project positively affected her life was really moving. And I really think you answered that question really well. So don't think bad about that.
Yeah, it was, when I teach at several classes at the University of Minnesota here, and I had invited her to come in as a guest speaker too one time. And I didn't know that she was going to show up to my class and surprise me bringing her mom. And so the two of them came. And in facilitating that conversation with them, it was the first time that either one of them had talked about the accident, had talked about her pathway to prison, had talked about that experience, and seeing that unfold, like I just knew that I was witnessing something in that moment that like my class had that we were just, they were just getting into this topic, and I witnessed the most beautiful exchange between mother and daughter. And what a privilege to watch that story unfold and to see their family thriving now. Just incredible.
That's amazing. I would have cried. That's so nice that you got to experience that.
I get a little choked up just talking about it, and I am not a crier, I promise.
So kind of kitty corner to this topic, we're going to kind of talk about institutional racism. So it's obviously very prominent in America today, especially in our justice system. So for example, Black women are more likely to be incarcerated than white women. How do you think this racial imbalance impacts births in prison and the relationship mothers are able to form with their child? And how does this impact your work in the field?
Great question. Yeah, I mean, I think we know that there are so many intersecting aspects of marginalization on this topic, right? And so we think about the criminal legal system and the structural racism that is built into every step of the criminal legal system. And then, I mean, aside from that, we think about the structural racism that is built into the healthcare system and what we know about disparities in Black maternal mortality, right? And these things with this topic are just like running into one another and intersecting in a way where this is a group of moms that is at exceptionally high risk of adverse outcomes because of all of the structural experiences, the social determinants of health, pre-incarceration, this really unoptimal environment that they're in terms of a prison system that was not built for pregnant people, right? Was not built to provide care, is not a nurturing and welcoming and wonderful space for maternal and child health. And then all of the challenges in terms of the separation. And so you mentioned, Lillie, this idea that Black women are disproportionately represented in our prison system. And that is true. And in Minnesota, a really important point in terms of Native American and indigenous women being disproportionately represented. Despite the fact that Native women make up less than 2% of our state's population, they are 25% of the pregnant women in prison. And so when we consider, right, and it was years ago, there was a great article in the Star Tribune about how Native American women have the highest rates of arrest in the city, even more so than African American men. And when we think about what Native American women are being picked up for and arrested for, and having this intergenerational patterns of separation of family really at the hands of the state. And then when we think about who's in prison and what they're getting, right, these are families that need so much more than they're getting from these broken systems right now. And again, thinking about what this means, the historical trauma, the generational trauma for these families of forced separation again, but now in the context of a mom's incarceration. So you can see sort of how all of the layers of racism play into compromising the maternal and child health in this population.
Absolutely. Thank you so much for answering that. I think that it provides a lot of information for everybody watching. And so this is obviously a very heavy topic. We noticed that you're involved in many forms of advocacy. What are some of the ways that you can balance all this into your life while still taking care of your mental health?
Oh, that's a good question. I told you that my Instagram account is like not one I use for work. So all of a sudden I like see names popping up that I'm like, oh, these are people in my personal life that are on this. Gosh, that's a good question. I mean, I have a really, really amazing partner. And I feel like my husband is just a huge cheerleader and champion and has helped ground me and provide just cheerleading for the work, right? Recognizing that this is hard, and really being an amazing father and husband and partner and friend that supports my mental health at the end of the day. The work in collaboration with people like Autumn and Erica and Ray, I mean, this is hard freaking work. And I cannot believe I've been doing it for 12 years now, but like, these are some of the fiercest, smartest, passionate women that I know. And like to get to do that, to do this work with them is a privilege, right? What an opportunity. It's hard. And that keeps it going from a mental health standpoint. And then I would just say that there are a lot of things, and I think self-care looks different for everybody, that there are a lot of things that I do for self-care. For me, it's exercise in the morning and a warm cup of coffee every single day, right? Mm-hmm. That's time to sort of ground myself in the day and get ready to dig in. And, I think the other thing is sort of really not letting not losing sight of how horrendous this system is and how harmful it is. I mean, in some ways that's an effort in self-care too, just the constant monitoring of like, no, this is unacceptable, right? No, this is a violation of their human rights. No, this is against the law. And I think sometimes not getting jaded by that, but recognizing that we have the capacity to make change here. And when I think about the things that we've accomplished in partnership with the Minnesota Prison Doula Project over the last decade, like that fuels this fire. Like there is so much work to be done and so much opportunity for collaboration. And if we can continue to center the voices of people who are directly impacted by these issues and leverage our privilege to make change, like for me, that is an exercise in self-care, like just coming back to like, what is the work and what can I contribute? And recognizing that I am one of many contributing in these ways and that this is a collective work.
Awesome. Well, it's great to hear that you prioritize your mental health, especially in situations like these. And having a support system is so incredibly important.
Yeah, especially because we're so used to talking about the mental health of the people that we're helping and how to support their mental health that usually that conversation of how to take care of yourself isn't usually had. And so being able to be open with us about that and really share how you take care of your mental health with people that you know on this live stream, like that's really amazing and really incredible.
I'm asking me to
super happy.
Sun is out because if you had asked me yesterday when it was raining and dark, I'm not sure I would have.
Oh, for sure. So we're kind of getting close to the end here. So are there any organizations or resources you would like to share with the audience and like what we can do to boost you up?
Yeah, great question. So, I mean, I would love folks to check out the Minnesota Prison Doula Project, of course, and the Ostara Initiative and our sister programs. So getting to the Ostara Initiative page would be great. I'm a huge fan of the Minnesota Second Chance Coalition. I would encourage folks who are here locally to go eat at All Square and check out all of the amazing grilled cheese sandwiches that they have. And then tremendous, like, great work that is happening over there. And gosh, other things that are happening. I think those three are the things that come to mind immediately.
Cool.
So, something to connect with, two things to connect with, and something to eat. Not bad.
Some mental health. Go get some grilled cheese, right?
Yes.
Yeah.
All right. Well, thank you so much for joining us and sharing all of your work with us. We really appreciate you taking the time out of your day to meet and talk about this very important issue. Is there any kind of last note that you want to leave our viewers with, sort of like a call to action possibly?
Gosh, that's a good question. I would just say thank you for the invite, and I would encourage people, Mother's Day is right around the corner. And so if you want to honor a mother in your life, I would encourage folks to make a donation to the Minnesota Prison Doula Project so that we can continue to support moms in Minnesota that are birthing in prison and in our community.
Such a wonderful point.
Yeah, that's such a good idea. And honestly, that was a good reminder. I totally forgot Mother's Day was around the corner. So
you can give something to your mom through a local supporting other moms.
That's awesome.
I love that. So thank you so much for joining us and for sharing your experiences and being so open with us. It really is an educational experience for us, and sharing your knowledge is honestly such an honor. And we really appreciate it.
Awesome. Thanks again for the invite. You guys have a great afternoon.
Of course.
You
thank
too.
You
Bye.
as well. So for all of our viewers out there, make sure to follow us on Instagram at HUCJL and Facebook at Hamlin University Center for Justice and Law. And make sure to tune in for our next Spotlight, Prison Doulas with Raylene Baker. Thank you all for tuning in.